everyone, this is Key with Chevy&kee, and I'm coming now with a video that is very sensitive, not only for me, but it may be sensitive for some of you that are experiencing something similar. And this is regarding grieving and a loss of a loved one. It could be a parent, a spouse, a child. For you, it may be the loss of a relationship. This particular video, I'm speaking about the loss of my husband, friend, best man, protector. It's unfortunate because his birthday was yesterday, and today I feel even more sad, loss. I don't understand why some days I wake up and I can live as if he's still here and everything's normal. And the very same day, before the day ends, I'm in shambles, mentally, emotionally. And I know this is all part of the grieving process. And I am trying my best to trust that this process is going to ultimately lead me to a space where I am going to be able to see the healing, the recovery to some extent, and the ability to see that it was not all a loss in Chevy's passing. I know I'm at the very beginning because he just passed in April. And I will try my best every day to trust the process of grieving the loss. The more important topic that I want to really discuss in this particular video is the awareness of the type of cancer Chevy had. We were told by doctors, numerous doctors, that he had renal cell carcinoma, which is kidney cancer. And through my reading of his entire medical records from the immediate, more recent, shall I say, hospital admissions from the end of 2023 and the beginning of 2024, and my research for the last 3 months, I have come to a pretty solid conclusion that he had multiple myeloma. Multiple myeloma is a blood cancer. Chevy initially in 2022 was told that he had renal cell carcinoma, which is kidney cancer. He was told this based on them finding a 10-inch mass on his left kidney. The kidney was removed in July of 2022. They checked 2 different times after that surgery for any remaining cancer cells, and they found none. Fast forward to 2023, Chevy started showing signs of kidney failure, even though the doctors did not express a very urgent need to treat him for chronic kidney failure. They minimized it. The ultimate issue is that they missed that he had multiple myeloma. It's a cluster of symptoms and signs for multiple myeloma that Chevy had each and every one of them. Going back to as early as 2012, when he was initially diagnosed as being a diabetic, type 2 diabetic, they missed the fact that Chevy was showing signs of having nerve damage, shall I say. That Chevy was having issues with his bones. Chevy ultimately broke his right foot. The VA hospital missed that. They said that there was no breaks in his ankle or foot or toes when he went in. They gave him a temporary cast because they said that it looked like it was sprained. I mean, with multiple myeloma, it starts, shall I say, in your bone marrow. It's a blood cancer. It's running through your entire body. He had the issue with that break in his foot in 2019. They ultimately found the small lesion on his left kidney in 2019. They did not discuss that with him. It was in his medical records, but they never discussed that with him when I went back and read everything. And so fast forward in 2022, they found that he also had spinal stenosis issues that was a result of his bones having problems based on multiple myeloma. He had a spinal stenosis surgery in 2020. He had his heart surgery in 2019. All of this points to multiple myeloma. When he was diagnosed with his renal cell carcinoma, and I do put that quote unquote renal cell carcinoma, he was 66 years old, about to be 67. One of the markers for multiple myeloma is that you have issues with your kidneys, your bones, and your nervous system. Chevy complained for 7 years of what we initially thought might be neuropathy, but I even said to him, it's something beyond neuropathy, because he was having problems in his shoulders, his neck, his legs, his feet, and his hands. All signs of multiple myeloma, in addition to him having kidney issues, in addition to him ultimately showing that the renal cell carcinoma manifested. That's only because now the multiple myeloma has metastasized. So in 2022, we're looking at the cancer spreading. Ultimately, in 2023, the end of 2023, Chevy was showing signs of having recurring infections, another marker for multiple myeloma. He went into the hospital and had to be on antibiotics for 60% of his stay. By the beginning of 2024, he's in the hospital again. He's showing markers of the protein coming up. They did not disclose that. They did not discuss this with us. All of this points to multiple myeloma, and the doctors misdiagnosed. Yes, they said he had renal cell carcinoma. They did not go to the extent of looking at the fact that it was not the initial cancer. It was multiple myeloma that metastasized and went to his kidney. Yes, they're able to take the cells and look to see what type of cancer cells. However, what I researched and found is, yes, multiple myeloma starts in the blood and the bone marrow. If it metastasizes, it can go to different parts of the body, kidney, stomach, colon. Those cells will then show, when you take a test from that particular organ, it will show cells of that organ. So yes, you're going to see renal cell carcinoma once you're taking the cells from the kidney. Chevy also fit the demographic because he's a black male. The leading group of individuals who have myeloma are black men. The highest population at the time of diagnosis are black men who are in their late 60s, mid to late 60s. All of this Chevy fit to a T. I asked them in January of 2024, this year, what's going on with his kidney? Chevy had low or chronic anemia and low hemoglobin for 3 straight months. The hospitals did not try and figure out if he was having issues beyond just, okay, the cancer is affecting your kidney and you're going to have low hemoglobin because, yes, the kidney is responsible for the hormone that helps in producing hemoglobin. They did not go beyond to try and figure out, well, in the blood, once again, going back to the blood, if the kidneys are not working and you're giving him the blood transfusions and it's still not sustaining beyond 5 days, they did not go to the extent of trying to do more testing on the bone marrow. They did not even think of going and looking into the bone marrow until the end of March. He started going to the hospital in January. He had 6 admissions to the hospital, January, February, March. By the end of March, the VA hospital was saying they were going to do they were going to do a biopsy of his bone marrow. I truly believe they knew at that point that he already was at the end due to the fact of having myeloma. I just want to bring awareness to those of you that are listening that will come across this video, that if you're in the demographic of being black, being a male, being over the age really of 50 is when the screening should start. You are in a risk category if you fall in that particular demographic. If you have diabetes, if you have heart disease, which diabetes and heart disease kind of goes hand in hand anyway. Get screenings if you are a black male or female. If you are over the age of 50, one of the main things to look for is if you are having problems with your nerves, numbness, if you feel that you're having any kind of problems with your bones, fractures, If you have, like Chevy had a broken foot in 2019, it was very weird how when he fell, that he ended up breaking his foot. But if you're already having issues with your bones breaking down due to this multiple myeloma, it's very easy to get a fracture or to break your bones. So please go and get screenings if you fall within that demographic. If you are a black male or black female, if you are middle-aged, 50 and up, if you've had recurring infections that are unexplained. That's another thing. Chevy had recurring infections over a 5-year period that they were never able to explain, well, where are these infections coming from? If it starts in your blood, the multiple myeloma, it's very easy to get infections that are unexplained. The cancer cells are running through your blood and your bone marrow, which immunity and everything starts in our bone marrow. I challenged myself when I found out all of this information to bring awareness, complete transparency with what happened with Chevy, and knowing that Chevy's life can pretty much help save other lives. His story, his diagnosis, a lot of times a misdiagnosis, and his ultimate passing can help others not have that same fate. The most important part of all of this story is be vigilant and proactive. Doctors misdiagnose every day thousands of patients. So if answers that you're receiving are not sufficient for you, don't add up, don't make sense, get second and third opinions, do your research. The M protein that shows up with multiple myeloma sometimes goes under the radar based on the levels that doctors and labs are looking for in order to identify that the multiple myeloma is even present. So speaking with oncologists, make sure that you go into depth with them when discussing any kind of labs that may appear to show signs of any type of cancer. And hopefully this will reach enough people that not just one, but if it's only one person that this saves and changes their life, I am thankful to God, because I know that Chevy was misdiagnosed for at least 6 years. Multiple myeloma, another thing about it is it goes undetected for so long. Everywhere that I researched and I was reading on multiple myeloma, it's misdiagnosed. He also had, this is another thing, he also had a wound. It initially looked like he was burned and had a blister kind of like wound on his, I believe it was his left shin. Well, actually, it was the back of his leg, down like almost to where the back of his ankle would be. And I asked the nurse about it, and they dismissed that. I'm thinking at the time that it had something to do with his diabetes. But another sign of the multiple myeloma is skin. It's more blistery, and you can look this up. It's more blistery. It's not really like a rash, if you will. It's more of a blister type wound that appears with multiple myeloma. It can show up on any part of your body. He also had this towards the very end in March, I noticed, because I was very in tune with Chevy, looking at his skin, looking at his overall just body health, everything, but especially his skin. At the end, he had some of these more rash. It did look more like a rash on his face, but all of this was due to the multiple myeloma. So please, if you fall, like I said, within that demographic, being over the age of 50, but especially if you're in your 60s at this point and you've had a cluster of what I'm talking about going on at the same time, right? Issues with, you feel like you're having nerve damage or something's going on with your nervous system. You might have incontinence. Chevy had incontinence intermittently over a 5-year period of time. That also is pointing towards nerve damage. He was having problems with his bones. He was saying that he was feeling like his shoulders, his arms were hurting. That's not really neuropathy. That was because of the bones. He had the fracture. If you are, if you're having problems with your kidneys, you feel like you're having problems and you're having pain in the back, down close by, it's the lower back, if anything. A lot of times people have pain down in that area. That can be signs of kidney issues. Of course, your urine being dark. Go to the urologist. Go to a nephrologist if you are suspecting that you may be having problems with your kidneys. All of this points to, and like I said, it's a cluster of things that if they're happening all together, it can be a sign of you having multiple myeloma. So hopefully this, like I said, will reach enough people. And of course, you can share this video if you suspect that someone that you know and love is experiencing this. Because I know without a shadow of a doubt, Chevy did not have just renal cell carcinoma. He had multiple myeloma that spread and then ultimately spread to his lung. So I pray that this can help someone, because I know Chevy's passing is not in vain. And I know that Chevy, he fought a good fight, and at the end he was in peace. He did not have pain. Fortunately, he had no pain. And he was at home with me, and I cared for him until he passed away. And we were able to come to terms with his ultimate fate before he passed. And I pray that those that are out there that have a similar situation, you are able to have a full awareness of what you actually have in terms of whatever diagnosis, and that you're not misled by the doctors and the lab work, and you truly understand what you're going through. Because I think that was the most, it was the most difficult part of Chevy's entire battle, that he was misdiagnosed. He was misdiagnosed. He didn't really know what was going on. And we trusted the doctors for the most part, and the doctors did not give us the correct information. So until next time, I want to thank y'all for listening. I want to thank y'all for just being on this journey with me. This is a grieving process that I'm going through, and I thank y'all for tuning in and listening. And until next time, Be blessed.